I'm joined by James Waterson from BD. How are you, James?
I'm okay, I'm having a great show so far, but it's only day one.
So tell us about the strategic priority for BD in the Middle East.
The strategic priority for BD in the Middle East is the same as it is globally. It's essentially patient safety. But another component of that is we know that healthcare professionals work best when they're not absolutely overwhelmed and under pressure. So efficiency is an important story as well. We look at that in terms of connected medication management. And connected medication management means, it means right patient, right medication, and technology can help with that. And that's a closed loop, and that's fantastic, right documentation. But also what we want to see within larger scale organizations is each patient transaction, each time there's a medication consumed by a patient, whether that's intravenous or whether that's oral, that means that we've got a dynamic inventory. All the time the system is calculating. You can see these fantastically beautiful screens behind me of a very dynamic process. There's adding and subtracting as medications are joining into the organization, as medications are being consumed, and as they're being documented. I've got a dramatic amount of inventory action going on. Manual inventory in the 21st century cannot possibly keep up with the demands of healthcare organizations. And that's really where we are. We're going to use technology. There's about 30 to 50 touch points within medication chains, all the way from medication entering the organization through to administration with the patient. And we want to make sure that each touch point is done safely, done efficiently, doesn't waste time for healthcare professionals, but also creates data for the organization so that they can use that data for forecasting and for making sure that they know total inventory stock within. The often forgotten medication error that occurs globally is actually stock out, not having the medication available for the patient at the right time in the right location. And again, technology can help with that once you connect up that medication chain. I know that's a lot of information in one go, but it's because it's so connected, it's quite difficult to talk about it in isolation. It's a dynamic process. But at the end of it is the patient receiving the right medication at the right time with the right documentation. But for the healthcare worker, automation again can reduce even the labor of documentation. We know that nursing staff, for example, only spend about 20% of their time on direct patient care. 35% of their time is spent on documentation. If we can automate that by scanning the patient, scanning the medication, scanning the infusion pump, and that closing out to the electronic medication administration record, we've taken a big chunk of that work away.
Sounds really exciting. What are you most looking forward to at Arab Health?
What am I most looking forward to? It's always great to see customers again. And again, I came back to the Middle East in 2019 after doing a little bit of time in Switzerland for the company. And I got excited about seeing my customers again. And then I didn't see them for quite a long period of time. And we all know why. And let's not mention that anymore, the pandemic. But now we're getting back out there again. But really, it's a great time to touch base with them. And I work for medical affairs. So it's great to talk about data stories because our customers are really the experts, right? They're the people who use these tools. They optimize the way they use them. They build them into their workflows. Every single organization is different at different levels of integration, different levels with hospital information systems, but also imaginative ways of using data. I've just been speaking with one of our customers about supply stations, but in fact we started then to talk about the amount of data available in a pool of hospitals to think about things like medication adherence with patients at home and preventing medication error at home. And it's an area that we're moving into with home care very, very strongly.
Wow, so much to tell us, James. Thank you for your time.
No problem. It's always fantastic to see you and it's always fantastic to be here. Thanks again.